right, good afternoon, friends. Welcome. Today we are talking about one of my favorite topics and something that I'm super passionate about. One, because I work with a lot of women who have autoimmune conditions all across the board. Number two, I diagnose women with autoimmune conditions very often because I actually run the labs that show autoimmunity, where a lot of women come in, they're like, I don't feel good, my hair is falling out, my joints hurt, my skin hurt, like they have all these weird symptoms, and their doctor's like, oh, you're fine, you don't need testing. And then I do the testing and we find out it's either Hashimoto's or lupus or something along those lines. Number three, I personally have autoimmunity. I have ulcerative colitis, which is commonly associated with Crohn's. It's a digestive issue where your immune system attacks my lining of my intestines. Now, I get really passionate about this topic because it's so misunderstood. And I titled today, I think, something about causes of autoimmunity. And I think I usually pop on once a quarter with a fiery, like, someone sent this to me on TikTok about how to prevent autoimmunity, and it's such BS because autoimmunity is so interesting, and it's not relatively new, but the severity, the persistence, and the amount of people who have autoimmune disease is climbing at an amazing rate, an alarming rate. So what I want to do to cover today is my 5 top causes of autoimmunity, and specifically talk about pregnancy and microchimerism. So let's go through the top 5. Number 1, it's not because you're deficient in vitamin D and you weren't breastfed and you need to stop eating something, right? Let's just put that out there. Number 1, okay? It's the most common cause of autoimmunity is adverse childhood events, also known as ACE. You can take an ACE test. A lot of people will do that as well, especially for chronic illness, traumatic childhood events, including traumatic adult relationships, toxic relationships, narcissistic, abusive, whether it's physical, emotional, financial, sexual abuse. All of these trigger stress, and they affect our immune system. They can cause our body to lose immune tolerance. So a lot of women and men as well, I don't want to exclude anybody, but 80% of autoimmune patients are women. And knowing that the majority of women are not listened to, believed, or tested by their doctors because they're told, oh, there's nothing wrong with you, you're fine, it's just anxiety, here's some Xanax, go home. It's probably a lot higher than we actually know. So, and this is also one of the reasons why it can be triggered later in life, is where you end up in a toxic or abusive relationship and you get sick. Maybe it's cancer, maybe it is something like Crohn's, IBS, thyroid issue. Seems like it came out of nowhere, right? And this is a really big issue. Dr. Gabor Mate has an excellent book. I believe it's called When the Body Says No. Alice Miller has written some of the top books about this subject, between health, mental health, physical health, and our childhood and our parenting. And it doesn't even have to be your parents, how you grew up, where you grew up, how you were treated, etc. Number 2 on my list of top reasons behind autoimmunity is actually a history of birth control, especially the pill. Now, nobody talks about this. It's well researched, it's well studied, but when I was handed the pill at age 16, no one said, oh, by the way, if you take this, there's a risk of having autoimmunity later in life, maybe or maybe not. We're told the risks of clots and strokes and heart issues, and hey, at least you're not pregnant and your hormones are better. But no one talks about, well, you might get lupus or you might end up with Crohn's. Like, it's because it's such an unknown. They can't, most people don't even consider it. We're talking about the risk, or don't even consider it a risk, even though it's documented. Number 3 on my list is pregnancy. And I talked a lot about this with my patients, and no hate to anybody, but a lot of the functional docs that I learned from, I think they oversimplified what happens during pregnancy. They're like, the immune system turns off so you don't attack the baby, and then it just gets confused after you have the baby and can develop into autoimmunity because of all of these other underlying factors. That may be it, but the actual issue is microchimerism, which is what we're going to talk about a little bit more in depth, and I'll post some of the links, research links, so you can read more about this and what it actually is. Number 4 on my list is genetics. Now, of course, if you say, well, my mom has lupus, so I have lupus. Thyroid is very common to transfer, especially from mother to daughter, because our maternal mitochondrial DNA really expresses that. So yes, if you have a family history of autoimmunity, it is a possibility that you can have that as well. It can be that you don't ever have any of those issues. I have a history of thyroid issues in my family, but I don't have any thyroid issues. That's wonderful. And sometimes your genes get triggered, right? We can turn them on and off. We have epigenetics as a way of using our lifestyle, and the way we eat and drink and take care of ourselves can impact our genetic expression as well. What's else is really interesting is they found that people with Crohn's and colitis actually have a gene that is protective against the Black Plague. So if you had an ancestor that survived the Black Plague, apparently I might have one. I haven't been tested for it, because I don't think it's necessary. But genes that are meant to be protective for some things can actually be harmful for other parts of our health. So we might blame genes in a good way or a bad way. I might survive the Black Plague. That would be, hopefully we'll never experience that. But, a lot of people just want to jump right to genetics, and that's not always necessarily the case. And then number 5 on my list right now is inflammation. And inflammation is ubiquitous. It's in everything. There is no escaping it. There's no perfect lifestyle out there. So I just encourage you to do your best, right? So when we have leaky gut issues, leaky brain, leaky lung, all of these things can reduce our immune tolerance and confuse our immune system. And that can lead to autoimmunity. And it's very complicated. The books, we could spend hours and hours and hours and years and years and years discussing the physiology of what all this looks like. But really, our lifestyle does play a huge factor into this, as well as toxins, and toxins that we can't help. Like, we have birth control in our water and antidepressants in our water because we can't filter that out in treatment centers. So my second list is birth control can cause or be correlated with autoimmunity, and yet we're drinking it because we're drinking water. You're not even on it. We're still having that exposure. The toxins that are in plastics, that are in our makeup, in our hair care, in our water, even if we just can't avoid them. And these things can trigger our genes, and it's not your fault, right? Stress, of course, is a huge issue. Drugs, alcohol, smoking, the types of food that we eat, all of these things affect us. So what I want to circle back to here is the pregnancy and the microchimerism. Because I really wanted to dive into that, and I found that the research is really interesting. The earliest article I could find was from 2004. So what it talks about and what that means is, when we're pregnant, our baby shares everything with us, right? We share food, we share nutrients, we share oxygen, and the other thing we share is our DNA. And not conceptual DNA, but as the baby is formed, our DNA and the baby's DNA commingles and switches. So this is really protective for the baby because it helps the mother's body recognize the baby and go, okay, this is not an attacker, this is not an alien invasion, we want this baby. we want to have the baby here. And it can also be protective for the mom to have the baby's DNA within her. And they've found that children's DNA in women's brains and bodies up to 27 years post-birth. So this is what chimerism is. and it's essentially where cells from one person are exchanged with another person. This happens naturally through pregnancy. If I can find the right article, fetal, so pregnancy, twins, so twins in utero will exchange DNA. Things like blood transfusions or organ transplants obviously are going to exchange DNA. So we have that chimerism, and that's an old word that is commonly linked of mythology, like a chimera. It says a monstrous fire-breathing composite creature of Lycia in Asia Minor, composed of the parts of 3 animals, a lion, a snake, and a goat, usually as depicted as a lion with the head of a goat arising from its back and a tail that ends in a snake head. So a combination of DNA in one animal. Like I said, mythology, but when we're talking about pregnancy, this is protective. Now, we don't necessarily know, however, we do know that natural microchimerism, meaning pregnancy, does trigger within the woman a change in T cell activity in the immune system. So we have naive T cells, we have Th1, we have Th2, we have Th17, we have millions of cells. Like, our immune system is so incredibly complex. So what that does, though, is that external DNA from the baby can trigger our immune system, and instead of going, oh cool, this is our kid, it says, oh no, this is an attacker. And because that DNA becomes embedded within our cells, it causes our immune system to attack. This is most commonly associated with rheumatoid arthritis, lupus, Sjogren's, and Hashimoto's. So again, why some women feel great, they get pregnant, and then either immediately after, a few years after, and maybe even later in life, they're like, how did I get Hashimoto's? Why everything hurts? Where did this rheumatoid arthritis come from? Where did I go wrong? And you didn't go wrong. And I think this is such an important message, because for myself, I laid in bed in the hospital, literally dying from sepsis and medical negligence, with doctors slamming their clipboard on the desk going, I don't even know what you want me to do for you. I don't even know why you're here. I'm like, well, first of all, I'm dying. And sitting there blaming myself, like, how did I get so sick? What did I eat that was so wrong? What did I do that was so wrong? And in the wellness world, there's always that tweet being shared, like, it's not your genetics, it's your lifestyle. And if you ate this diet, right? Like, how many diets, every patient I talk to, they're like, oh, have you heard of this plan? Have you heard of this meal plan? Have you tried this? What about keto? What about carnivore? What about Galveston? What about the Tiger protocol? Like, there's a million out there, and there's no one thing that's going to be curative. There's no one thing that's going to be preventative, and we could do our best, of course. Please do your best, but that doesn't mean that we are able to prevent everything. And so I had to go through a huge paradigm shift of, Alison, your stress was out of control, and your stress ruined your gut, and you gave yourself colitis, to, okay, my body is having an experience. I don't know where it came from. Hold on, if I go back to my list, I have 1, 2, 3, 4, 5. I've got 5 of 5 on the trigger list. So I can't sit here and pinpoint, and that's so frustrating for me as someone who practices functional medicine, to not be able to go, oh, that's what caused my ulcerative colitis. I just needed to be gluten-free. That will have cured everything. Or, oh shoot, I shouldn't have had that bottle of wine. I gotta cut out alcohol, right? Like, there's not one thing, or it's Lyme, it's this infection, or it's a parasite, or like, we want to know why, and sometimes we don't, and it's really freaking difficult to not know why, because we can't go back and fix it. I can't take my kid's DNA out of my body. I had a theory that it was more related to male DNA because that is mainly what I have seen. However, it does appear that potentially having biological female babies and exclusive breastfeeding are higher risk for the mom for microchimerism. How interesting is that? But we need more research. This article is 2022. This article is 2019. This is all relatively new. And we still don't even understand the role of how necessarily what part of the immune system is triggered. So they do think that it is transforming growth factor beta, TGF beta, as part of that signaling pathway, but it still affects things like TNF alpha, interleukins, cytokines, all of these good inflammatory things. And if you know anything about immune modulators like Remicade, which is what I was on, that suppresses TNF alpha. We take immune suppressants to suppress these things. So just how incredibly interesting and complex our bodies are, and how interesting that baby microchimerism and the pathogenesis of Sjogren's syndrome. Fetal DNA was detected in women using PCR tests of some of them, but we don't have that information. But we do know that it affects our healing. Look at this. Microchimeric fetal cells also express collagen 1, 3, and TGF beta 3 in healed maternal scars. So they found male presumed fetal cells in healed maternal cesarean scars after pregnancy suggests that in response to signals produced by the mother's skin injury at the cesarean section, fetal cells migrated to the site of damage to become involved in the tissue repair or proliferate locally. So we have good things with this. We have some not so good things in this. We have the DNA that can trigger us. We have DNA that can heal us. And so just information for you to kind of think and look and ponder upon. And I'd love to hear your thoughts about this. And maybe you found that your own pregnancy may have affected you. And they do find this with miscarriages, abortions, full-term pregnancies, preterm pregnancies. We still carry these cells with us. So just something to think about as we go through our healing journey. So thank you for tuning in. If you have thoughts, questions, ideas, research you want to share, I would love to see it as we go through this journey and support the research that's out there as we learn. So thank you for being here, and we'll see you next time.